Well, the question on everyone's mind right now is when will la-crosse get the first doses of the new COVID-19 vaccine? News 8 Now's Tyler Jobe has been looking into this and joins us now in the studio to explain. Tyler?
Mike, well, both healthcare systems don't know just yet, but they have plans in place for how they will roll it out to healthcare workers. Since the FDA approved Pfizer's coronavirus vaccine for emergency use Friday, it took just 3 days for UW Health in Madison to get their first shipment. As for la-crosse, that remains unclear.
It's about the marathon.
But both Gundersen and Mayo-Clinic-Health-Systems know which types of healthcare workers will be getting the vaccine first when it does arrive.
We're going to start with staff who are directly on the front lines.
It will be going first to the people who are at the highest risk and working in inpatient units and in respiratory clinics.
Since the vaccine is being used for emergency use,
it's not a mandated vaccine because of that.
It's rather highly recommended.
We want to interrupt this transmission and this pandemic.
Whenever the first doses arrive, they will need to be kept in ultra-cold storage that's around -70 degrees Celsius.
There are dry runs that are going on right now, or practice runs, before we get the actual vaccine to make sure that all of our players that will be involved are doing this up to the appropriate standards.
It's going to take months for all healthcare workers to get vaccinated.
Just because you're not first in line or getting the vaccine in December or January doesn't mean you're not important.
But it's a starting point to put an end to this pandemic.
It will be very important that we get immunity to COVID-19 through use of the vaccination. That's really the only way we're going to get herd immunity, not only in our healthcare work.
Now, Mayo Clinic in Rochester was supposed to get the vaccine today, Morcom says, but due to a certain law in Minnesota, they cannot actually use the vaccine until next Monday. Mike?
Okay, thanks a lot, Tyler. And once the most at-risk frontline workers get vaccinated, the plan right now is for the rest of the healthcare field to gradually get their shots.